So we've covered the thigh, and now we're moving down to the leg. So what we're looking at here is a posterior view of the leg. This is gastrocnemius superficially on top. Before we get there, I want to talk a little bit about the vessels that will transverse down the posterior thigh. Okay, so first from the sciatic nerve, we actually branch into the common fibular, which you can see here wrapping around into that anterior aspect of the leg, and the tibial nerve running down. Now also, we have the artery and the vein here, which you would imagine is called the tibial artery and vein, but is not. It is the popliteal, because in this fossa is called the popliteal fossa. So there's the popliteal vein and the popliteal artery. Anyways, moving downwards, we now get to the musculature of the calf. A lot of people think gastrocnemius is actually the largest portion of this, but I'll hopefully change your mind here in a minute. That if I remove this, which is the gastrocnemius, two heads, as well as the Achilles tendon, you can actually see this larger muscle group underneath, and that is your soleus. And if I look at it from underneath, it's actually a pretty large cross section comparatively to the gastroc. But do remember the gastroc crosses that knee joint. Additionally, we have plantaris, which they're trying to show here with this slightly darker paint, which is just a small little muscle on the base of the calf here. And it's kind of like palmaris longus in the forearm, where some people have it and some people do not. But yeah. Moving deeper, we have a few muscles of interest. First is popliteus, which is shown here. Remember the popliteal fossa? That's the popliteus muscle. We will then move down, and we have interesting organization here. So this muscle here is flexor hallucis longus. Now, if you remember back to the forearm, when you looked at flexors and extensors, you could tell by what compartment they're in. So if you think of this muscle shortening, it's going to curl my toes. This is the underside of my feet. So you can call this the flexor compartment, or on the anterior surface, we would call it the extensor compartment. But as I was saying, flexor hallucis longus will control the big toe flexion, very important in gait. And also we have the flexor digitorum right here. Longus and brevis are always just on top of each other in the leg. Further, we have tib post, which is shown here, and it's underneath the flexor hallucis as well. So now we're going to flip over to the anterior portion. Hopefully nothing falls out. Where we see, oh, there we go, something fell out. Pop that back in. Whatever. Anyways, we see the tibia shown here. And this is what I've always done to ID them, is move there from the tibial section medially. You can kind of move laterally and ID the muscles in a predictable order. So we have tibialis anterior is the one that hugs the tibia. If you follow its insertion down, you can see how it stops early and does not run towards the big toe or the digits. So we know it's not extensor digitorum or extensor hallucis. Instead, we see this muscle here that runs down. You can watch the tendon dive towards the digits. Right? You're following that back up. So that's one we would probably call extensor digitorum. And you can kind of see hallucis here. Now, if you watch this little tendon, he runs all the way to the big toe. But the muscle belly in this diagram is kind of tucked in underneath the digitorum. So that's extensor hallucis. Right? And if you imagine it underneath, it's running down here, and there its tendon going to the big toe, whereas digitorum lies superficial to the hallucis. Last but not least, there's another compartment, believe it or not, which is the lateral. And depending on what book you're reading, it'll either call this muscle group the peroneals or the fibularis muscles. I call them peroneals just because it's easier, but you have a fibularis or peroneus longus and brevis, and the longus and brevis lie, once again, on top of each other. And they're very important for eversion of the foot.